Good morning. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm going to talk about, the title of the show is Give Teeth a Chance. And the reason I'm going to talk about this is because I feel like people are being sort of rushed into root canals or extractions, and the nerve inside the tooth may actually still be able to heal in some cases, and we need to give those teeth a chance. So I'm going to talk about trying fillings, certain kinds of fillings, remineralizing bases under fillings, and things like that for teeth. And we're also going to talk about gums and extractions and third molars and all the things that I think have the possibility that, in the interest of efficiency and what will my insurance pay, that people get sort of sent down the road of certain treatments which wouldn't necessarily be what they would choose if money were no object, or if they didn't have a dentist standing there saying, I don't think we should bother trying to do that. So I created this show in order to talk about issues that I think people don't get to hear enough about, and that if you go to a regular mainstream dentist, there are some things that you're not going to hear about, not necessarily because they don't want you to know about certain things, but sometimes dentists don't know about certain things, or they don't tell you about things that they don't think you're going to want, or they don't tell you about things that they've already determined that your insurance isn't going to cover, or they'll mention it briefly but not focus on it or expand on it. And they also tend, in most offices, and they're trained to do this by management companies and just the people that they've hired to help manage the practice or to manage their practice, that they want to maximize profits, maximize the bottom line. They're focused on the numbers, and they are going to work very hard to get you to sign on the dotted line for the treatment that brings in the most dollars per hour for the practice. The staff wants you to do that, especially if they're paid on bonuses and they get a cut of the month's production or collections. So it's not just about production, it's about actually collecting money, and they want to do the thing that's the most lucrative, and then they want to charge as much as the market will bear, so to speak. So on this show, Dental MD, I bring up all the other things that you might not get to hear very much about. And my reason for doing all of that is to help you ask the kinds of questions that will lead to the treatment that you prefer. Now, once people get a particular treatment, or especially if they spend a lot of money on a treatment, they're going to be very, they're going to feel very justified and kind of defend in their minds that they spent that money, and they're going to be very enthusiastic about the treatment that they chose, especially if they spent a lot of money on it. And that's fine. That's kind of, Psych 101, human nature type of thing, I guess. But the fact is that it's possible that had they known about other options, they might have selected something different, or asked to have it done differently than it was done. And I just don't want people to get pushed into treatments that they later regret, like a tooth that maybe could have an onlay, for instance, which is a kind of a partial crown versus a complete crown, a total crown. And it's just a matter of knowing about more conservative treatments that accomplish the same goal of strengthening and supporting the tooth, but less drilling is better. And it's very important for you as the patient to know about all of your options and what all of the pros and cons are. On the other hand, I have had people choose a conservative option to try to save a tooth or buy it, sometime and see whether, other options are going to be available to them. And I did have an experience where a patient chose to try to retain a tooth and see if the nerve would stay alive. It was a close one. The decay was near the nerve, and unfortunately their nerve did continue to deteriorate, and the patient didn't want a root canal, and so they had the tooth removed but didn't want to pay me for the treatments that I did to try to save that tooth because they ended up losing the tooth. That's not fair. If you choose a conservative treatment and you want to try to save the tooth, that's a valuable procedure. And most of the time, at least in my hands, because I know at this point which teeth deserve a chance like that aren't already dead or haven't already crossed a line with the nerve into the stage of being irreversibly necrotic or heading to total necrosis. So a lot of the teeth that I select or offer that kind of a procedure, most of them do not go on to die and become necrotic and abscess and require those other choices of either a root canal or an extraction. So, part of it is just the subtlety of knowing, and this requires a lot of experience, knowing which teeth to try these heroic remineralizing procedures on. I'm not talking about the remineralizing of minor etching on the surface of the tooth. I'm talking about large holes and decay that is deep enough to endanger the nerve or may even appear on an x-ray to be all the way to the nerve. So I'm going to talk about some of those situations in the next segment, how I make those decisions and under what conditions I think, the nerve of a tooth could recover or be stabilized and remain alive and not become necrotic or devitalize and require further treatment. So just, before we end this first segment, I want to just touch briefly on why it is hard to find dentists that will treat teeth this way. Part of it has to do with what I was saying earlier, which was efficiency, time is money, what will your insurance pay for, what's the most lucrative procedure for a practice. Practices today are under a lot of pressure to bring in revenue. They may have a lot of debt from opening a practice. They probably took out loans. The staff costs are high. They've got their staff on bonus pay in addition to regular pay, so they're under some pressure to produce as much revenue as possible, sort of like stockholders almost. Everybody in the practice has a stake in, maximizing revenue, which basically means talking patients into as much lucrative treatment as they possibly can. And that's a good month for that practice if they've done that. They look at the numbers and high five each other and have a staff meeting and celebrate with lunch or I don't know, whatever they do, and give bonuses. So that's one of the reasons that patients sometimes don't get to hear about certain things and get a lot of information on other things, positive information that makes them feel like that's their best option. But, I don't run my practice that way. I'm not very oriented toward money. I'm very service oriented, and I know that sounds kind of, I don't know how it sounds, but it's, we make ends meet. I'll just put it that way. The ends meet. If the schedule is full, the ends meet at my practice. And that's good enough for me. I didn't go into dentistry to just give myself a good job or to, earn, most of the dentists that actually become wealthy, they do it like how I'm describing, but they also use the money that they get to buy real estate and other assets, and those bring them more money, which allow them to promote their practices and bring in more kinds of equipment for doing more lucrative treatments. And it's kind of, that's really how it works. It's like any other business. But I'm kind of a simple, old-fashioned dentist, and I want to do only what's necessary. I know it sounds kind of different, but I really try to do as little dentistry as possible. I don't believe in doing interventions unless they're really called for, in my opinion, and my opinion's a little different from the mainstream on that. But I was a commissioner on the dental licensing board for 8 years, and I never do anything or allow anything to happen in my practice that isn't at or above what's considered standard of care dentistry. And I keep up to date with what the American Dental Association says is, promotes as standard of care. I keep up to date with what all the specialty areas in dentistry say is standard of care in their specialties. And I will never do any dentistry that is below standard of care by any of those definitions. But that being said, I will minimize the level of intervention where I can in order to allow your body and your teeth and the nerves in your teeth to do as much healing as they can do. And that's one of the reasons my fees are higher, is because that's where they need to be in order for me to do dentistry this way, and to work a little slower when I'm drilling or working on a tooth in order not to traumatize your tooth. And I'm going to talk more in the next segment about trauma to teeth and how that can endanger the health of the nerve. All right, you are listening to Dental MD. I'm Dr. Jessica Sapoff. If you have questions about any of the things that I'm talking about, and today's topic is Give Teeth a Chance, please give us a call at the office, 425-427-8899, or you can reach the front desk email, appointments@naturaldentist.com, to get your questions answered and see whether, my office is where you want to go for a second opinion or for treatment. All right, I'll be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Nice turn, Jill. Toby, isn't your sister doing a nice job as a new driver?
Sure. Hey, by the way, Dad, have you ever smoked marijuana? It's getting legalized everywhere, so it's okay to do now, right?
OMG, Toby, are you serious?
It's not legal everywhere, and it's not legal for kids at all.
This conversation can happen anywhere, and your kids need to know the facts. 76% of teens agree that with legalization, teenagers may be more likely to experiment with marijuana.
Legal or not, marijuana is harmful to teens' developing brains and can cause permanent damage. It could also cause heart and respiratory problems.
I heard it could lead to using other drugs.
61% of teens agree that teenagers who use marijuana are more likely to try heroin.
But marijuana has been around forever.
Sure, but the type that's out there now is stronger than when I was younger, so it's really important for you two to be careful.
I never thought about that.
Well, now's the time to start thinking about it.
Now's the time to talk to your kids about substance use. Learn more at rosecrans.org.
Conversation you won't find on the rest of the dial. Alternative Talk 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today's show is called Give Teeth a Chance because I think people get rushed into treatment. I think we're not, as a profession in dentistry overall, not giving the nerve inside the tooth, the pulp, enough of a chance to heal. And we've got our little guidelines, if the tooth does this and if it hurts this much and if it hurts when you do this and if it, hurts for this long and if it wakes you up at night, all that kind of stuff, so we can determine whether that nerve is past the point of no return. Is it over the fence? Has it given up? Is it dying to the point where it cannot recover, becoming necrotic? And if that's the case, then you're faced with, if the tooth still has enough structure to restore, then you're faced with a choice of getting a root canal or having the tooth removed. If there isn't enough structure or the tooth is cracked, then you don't have a choice. The tooth has to be removed. And if you think you can just walk around, if it doesn't hurt and it's self-draining, or you've taken antibiotics, or you've smeared some green goo around it and doesn't hurt anymore, pardon me for making fun of people who throw herbal stuff on their teeth. A lot of those things work in circumstances where they work, and it's great, and that's fine. But don't think that rubbing stuff on a tooth that is dead will make it okay to leave it there. In dentistry, we do not use the G word very much or at all, but in any other part of your body, if you have soft tissue, which the pulp of the tooth is, that has become necrotic, it is called gangrene, and it's like a medical emergency. You have to get rid of that. You do not want to walk around with dead, necrotic tissue in your body anywhere. But for some reason, people think that a tooth that has died, as long as it's not hurting anymore, if it still looks all right and seems okay, well, they'll just walk around with that. And I just don't think that's such a good idea, really. I just don't. And the thing about root canal treatments, the reason why a lot of people will choose, holistic people will choose to extract a tooth rather than get a root canal, that seems absolutely unconscionable and barbaric to somebody who thinks that root canals are just fine. And the majority of the profession and the majority of the public feel that root canals are just fine and no problem. And if it looks okay on the x-ray and it doesn't hurt, it's fine. It's okay. It's good. You've saved the tooth, they say. Well, it is impossible with our current state of technology to get every bit of dead pulp tissue out of that tooth. And it is impossible to sterilize the tooth. Now, in the case, there are some exceptions. In the case of a tooth that dies from trauma rather than from a deep cavity that infected the nerve and caused it to die because of infection, If the tooth died because of trauma, then it is sterile. It is not infected. There are not bacteria and other microbes and life living in the microscopic tubules of the tooth, which, if that is the case and a root canal is done, they can't get at those tubules. None of the devices or medicines, chemicals that they put in the tooth can get into the little tiny microscopic tubules. The molecules are too big. That's what we've been told. And they can't get in, and they can't sterilize the entire body of the tooth. They can just clean and disinfect the main canals, shape them, and fill them with an inert material that, once you read the ingredients, you may not agree with using that word for it, but that's what it's considered to be. And is it okay to leave an infected tooth? Because that's technically what it is. I talked to an endodontist once years ago, and I said, what about the dark area on the x-ray underneath at the root tip on a tooth that's had a root canal, that's got no symptoms and doesn't hurt, and that's the only defect, is that you can see this like little dark semicircle around the bottom of the root tip. Isn't that an infection? Shouldn't something be done about that? And the endodontist said to me, well, technically yes, but if it doesn't hurt and it's been like that for a long time and seems stable, what we like to do, he said to me, is instead of calling it an infection, which upsets the patient, we just call it an inflammation. We just tell them that's an inflammation at the bottom of the root tip, so it's okay. It's just kind of a chronic situation that's not getting worse, and it's stable, and just to leave it alone. Well, if that tooth is in your head, in your mouth, in your jawbone, you are the one that has a choice about what to do about that. The problem is that dentists overall will talk about things in ways that lead you to make the choices that they would make or that they think you should make. So the point is, and the reason I have this show, is to talk about things in ways that help you be curious enough to ask more questions and to help you know what questions to ask. And some of those questions are going to annoy some dentists. Have you ever asked questions, too many questions, and felt that little sort of feeling you get when somebody thinks you're annoying or asking too many questions? Well, you're probably going to find that. And if your dentist that you're talking to, sometimes it's because it's annoying and you're asking too many questions. But other times, remember, time is money. They're trying to be efficient. They're trying to earn money in their practice. When they're sitting there answering all these questions, they're not producing anything. They're not making tooth dust. They're not doing anything billable. And that's inefficient. And it's basically them giving away their time, which is usually quite overbooked in most practices, and they need to move on and do something productive in their mind in another room. So that's one of the things you're going to run into in a kind of a typical dental office. That's another reason why I have my fees set the way that I do, because I have time in my appointments for all those questions. And I want to make sure you get your questions answered. And I really have a hard time starting a dental treatment for a patient if I feel like that patient has more questions, or if I feel like they really need to ask more questions or get more information because they are making a choice based on incomplete information. And I really don't want to do a treatment in a case like that until they are absolutely sure and absolutely know and have investigated what their other choices are. So I will sometimes put off doing a treatment in order to give them a referral and have them go see a specialist about, if there is a specialty in the area, not the geographic area, but in that dental area that we're discussing in that appointment. Depends what it is, root canal or orthodontics or anything. So I will, in some cases, have somebody go get a second opinion or go do some more research before I will do a procedure. Even if that patient initially was willing to do a procedure, I don't want anybody to have regrets. And that's just the way I run things, because I like sleeping well at night, and that's what I need to do in order to be able to sleep well at night. So I began to talk about one of the exceptions to these ideas about root canals. Well, if a tooth dies because of trauma, like it got bumped and then the nerve was traumatized and became necrotic, it's still kind of iffy about those, but because, once it's dead, how long does it really take for it to become colonized? There's not a whole lot of research money for questions like that, unfortunately. So one of the things that we can do is periodically expose the tooth to ozone and oxygen, which does penetrate through gum and bone and tooth structure and kill microbes as it passes through. And incidentally, ozone can penetrate it's very small. It can penetrate the little tubules. We can actually further disinfect an old chronically infected root canal that's asymptomatic. The only problem is we don't really have research showing what the protocols should be, and we don't have any way to test the tooth and make sure it worked. We do know ozone will pass through these infected areas inside the tooth, and we know it kills bacteria. Is that good enough? Well, if you have a root canal and you don't want it extracted and you just want to do whatever you can to, further disinfect the thing, then fine, that's what should be done. And incidentally, that as that ozone passes through the gum tissue and bone and into the tooth, it is killing bacteria in any gum pockets that you may have as well. Periodontal pockets, infected gums respond very well to ozone treatment. All right, you're listening to Dental MD. We're coming up on a break. I'm Dr. Jessica Sapoff. If you have questions about today's show called Give Teeth a Chance, or any other questions about any dental topics and you'd like to get some answers and get a second opinion, give our office a call, 425-427-8899, and you can reach the front desk, appointments@naturaldentist.com. Email your questions. I'll be right back after this break.
I'm Dr. Anthony Lazowitz, and this is Climate Connections. Politics are not the only thing heating up in Washington, D.C. The climate is too.
By the end of the century, climate models show that if humans continue to burn fossil fuels at the same rate as today, that summers in the D.C. area will feel more like the climate at the border of Mexico near the southern tip of Texas.
That's Virginia Burkett, Associate Director for Climate and Land Use Change at the U.S. Geological Survey. She says the warming is already noticeable.
An analysis of temperature for the broad D.C. region shows that the year 2016 had the second warmest autumn on record since World War II.
The warmer temperatures are not just uncomfortable. A study from Columbia University found that before the end of the century, heat-related deaths in Washington, D.C. could nearly double to more than 200 a year. Burkett is particularly worried about the effects of extreme heat on the elderly, the very young, those with medical conditions, and low-income people who cannot afford to just turn off the air conditioning. But with the average summer highs reaching the mid-90s in the next several decades, everyone inside the Beltway will feel the heat. Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Alternative Talk 1150. We're on your radio at 1150 a.m. We're on your HD radio at 98.9 Channel 3.
So many ways to listen.
We're on the web at 1150kknw.com, streaming live audio and video as well as MP3 archives of many of our shows.
So many ways to listen.
And now, we're on your smartphone or tablet. Download our free app in the Apple App Store or Google Play and take Alternative Talk 1150 anywhere you go.
So many ways to listen.
An alternative to everything else on your radio dial. Alternative Talk.
Dental MD. I'm Dr. Jessica Sapoff, and I am a holistic, natural, biological, integrative dentist. There are lots of different words for it. I practice dentistry according to the principles of natural medicine. That means the least invasive and least toxic methods and materials known are used at my office, and that's all that's used. For people who are chemically sensitive or have multiple allergies or don't want to become chemically sensitive or develop multiple allergies, then you might want to consider an office like mine or my office itself as a place to get a second opinion about materials and methods and choices. It doesn't necessarily mean you're going to go ahead and get a treatment, but you might once you know what the rest of your choices are. And practicing according to natural medicine, it doesn't mean that I'm practicing medicine. I'm not curing things in the rest of your body as an intention, but what we're doing is recognizing that everything that goes on in your mouth, everything that happens to your mouth, affects the rest of your body, and also everything that happens in the rest of your body affects your mouth. A lot of times people get the idea that that only goes in one direction, and that the things that are done in the mouth, materials and techniques, are to blame for other problems elsewhere in the body. And I'm not saying that is never true. That is likely true in many cases. However, there are also, I'm certain, cases where problems in the rest of the body that are on meridians that pass through your mouth and pass through your teeth, those problems elsewhere in your body can show up in your mouth. Sometimes the mouth is the first place we see clues about what may be happening in the rest of your body. But I'm a dentist, and I'm only going to treat head and neck related issues and oral diseases of the teeth and gums and oral tissues, and TMJ, which is directly related to mastication, chewing of food, etc. And I will refer people to get the other parts of their body that are not within my scope of practice checked. And a lot of other practitioners don't necessarily understand that what they're looking at may be connected to something that happened in the mouth or maybe affecting something in the mouth. And it's nice if we all understand what those connections are, but the important thing is to get the problems dealt with and healed. Allow, not that someone's going to heal it, but that things are done that allow your body to heal so you can get on with what you came to this planet to do. Now, natural medicine and natural dentistry are aimed at allowing your body to do as much of its own healing as possible, nudging your body to do healing when possible rather than jumping in and doing an intervention to your teeth or gums that results in a permanent change to your teeth or gums without first giving your body a chance to heal the problem with natural methods that are less invasive or non-invasive and non-toxic, or less toxic at least. So that is the goal of practicing the way that I do, and that is what underlies everything that I do, everything that I suggest, and everything in the manner that I do things. So decay, let's talk about this in terms of tooth decay. Tooth decay is a rotted portion of what should be hard tooth structure. Now, whether that's completely caused by local factors or your diet, or if it's systemic. I mean, when most dentists say, things about your diet can cause decay, they're talking about stuff that touches the teeth. But it's another possibility is that there's a systemic component. For instance, your saliva is supposed to be remineralizing your surfaces of your teeth 24/7. But is your saliva governed by local factors? A little bit, and transiently, just for the few moments that you have whatever you have in your mouth. Your saliva consistency or pH obviously changes. The amount of saliva changes. But primarily your saliva is a systemic controlled issue. So what's happening in your body systemically, even psychologically, will affect the quality and quantity of your saliva, which in turn affects whether your teeth are able to remineralize maximally. So saliva has to be optimal, and that means if you're under stress or you have adrenal fatigue or you have, sleep apnea, which causes high levels of stress over and over again all night long, and you are on caffeine and other things during the day to stay awake, your saliva quality is going to suffer. The amount of saliva is going to suffer. A lot of medications cause dry mouth, which is less saliva. Stress, it's just like you're about to walk on stage. And for some people, they're stressed to some degree most of the time. I mean, this is a very stressful time to be on the planet, let's face it. But whatever you can do to try to overrule that by deep breathing and meditation and yoga and other things that bring about more joy and bliss and feelings of love and gratitude, that it's lovely, right? I mean, that's nice. We all want that in our day, but the effect on your health, the field that you generate by having those feelings predominate, not just for 20 minutes a day, but predominate your life. That's when the field created by those emotions and that state of being, I believe that's how we can maximize our ability to heal and overcome the things on the planet and in our lives that work to the opposite effect, like cause us stress or cause us exposure to toxins and whatever that makes it hard to heal or interferes with healing or stops healing or destroys our health, if in the case of very toxic chemicals, for instance, or radiation. So this is important, and this is part of thinking about health in a holistic manner. Now, in my office, because I'm a dentist, I have all of these beliefs and intentions underlying everything that I do. And everything I do is focused on dental issues, procedures that promote your own body's ability to heal, that are within my scope of practice, which is dentistry. So I do limit what my procedures are. Now, I believe that ozone treatments and oil pulling, which is gently rolling natural oils of your choice around your mouth for 18 to 20 minutes, and other kinds of, supplements that you might take to help with dental healing that have vitamin K2 and prevent decay, like cod liver oil and things like that, butter oil, that while we recommend those things on the basis of their impact on your oral health, these things also can impact your overall health. And I just want to point out that the oil pulling, for instance, people ask, why do we have to do that for 20 minutes? And it turns out this is an ancient Ayurvedic technique. And anything that's around your teeth and gums that's lipid soluble, that dissolves in oils and fats, will come into the oil in your mouth and get stuck there. You're going to spit this oil out when you're done swishing it. And you don't have to swish vigorously, just gently. But why 20 minutes? Well, it turns out that it takes 18 minutes, I believe it is, for your entire bloodstream to make one circuit around your body. So in 20 minutes, all of your blood will have passed through the vessels in the tissues of your mouth. So now, is it a dental and gum health procedure, or is it a full blood detox? Well, the Ayurvedic instructions were, I believe, 18 minutes or whatever the equivalent time delineation was at the time. And if you do this for 18 to 20 minutes, I believe that toxins will come not only off of your teeth and out of your gums, but may also pass through the reason your inside of your mouth is pink is because the tissue is very thin and there are a lot of blood vessels in the surface of the tissues of your mouth. Well, there are a lot of reasons for that, but the advantage that we're discussing right now is that it's possible that toxins that are in the blood may get pulled through the vessel wall and through the wall of the oral mucosa into the oil and be trapped there. So it is maybe theoretically possible that this is detoxing your bloodstream, which would be a wonderful thing. But when I, as a dentist, recommend oil pulling, I'm going to let you know about that. But the reason I would have somebody do oil pulling, that I, as a dentist, would recommend it, is to help with the health of your teeth and gums. And so I do recommend that people do this. It's not harmful. There's no limit to how often you can do it. I've had people say that they feel that their breath is better. The tonsils, I've had reports that tonsils improve. Sometimes mouth odor isn't from the teeth and gums. Sometimes it's from your lungs. Sometimes it's from your stomach. Sometimes it's from your tonsils and your throat. So there are, a lot of different ways to approach helping people with odors that they're worried about in their breath. And oil pulling is one of the ways that people have reported that things improve. So we are coming up on a break. When we return, I'm going to talk more about how I prevent trauma to teeth as part of my natural medicine approach to allowing your body to do as much healing as it can do. And part of that is by not causing any more trauma during a procedure than necessary. And that can vary depending on who you go to. So you're listening to Dental MD. I'm Dr. Jessica Sapoff. And if you have questions about any of the topics we're talking about, give the office a call, 425-427-8899, or reach us by email, appointments@naturaldentist.com. I'll be right back.
I was feeling so alone.
I was going through a really difficult time.
I was embarrassed and a little scared.
I didn't want to bother anyone.
I didn't think they'd understand.
I thought it would just make things worse.
It was tough at first, but I did it.
It ended up taking a huge weight off my shoulders.
I feel a lot better.
I'm glad I asked for help.
I asked for help.
I asked for help.
I asked my teacher. I asked my aunt.
I asked my dad.
I asked my mom.
I asked the Trevor Project.
Now, I feel like I can get through this.
I know that I am brave.
You can do this.
You can do this.
You can do this.
Ask for help.
Ask for help.
Ask for help.
Ask for help.
Whatever it is, ask for help.
If you're thinking about suicide or need support, call the Trevor Lifeline at 1-866-488-7386. Trained counselors are there to help 24/7. Ask for help.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Seattle, Tacoma, Antwerp. That's right. We're streamed worldwide on our app and on the web at 1150kknw.com.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. During the last segment, I was talking a little bit about decay itself. I'm going to go back into that, and I'm going to talk about how I do treatment in a way that is as atraumatic, preventing trauma to the tooth and the nerve and the gums and everything around the tooth and the jaw and the person who owns those things. So it is important not to traumatize teeth. Today's show is called Give Teeth a Chance, and we want to maximize the ability of the nerve or the pulp inside the tooth to heal, and minimizing trauma during procedures is one of the ways to assist in that process. Sometimes, in the interest of staying on schedule and doing things quickly and being as efficient as possible, and in most offices, it's very primary for them to stay on time and do, and that is important. So, but they also want to have the appointments be as short as possible so they can see as many people as possible, and they double book and they whatever, and they've got everything very efficient, and they do everything the same way every time. The assistant knows exactly what to hand the dentist. Everything's very clockwork, and that's all fine, except that my primary goal when I'm doing a procedure is to not traumatize the tooth. Sometimes that means I go slower. So I know this, so I have longer appointments. That's one of the reasons the fees are what they are, but this is the reason, and I'm going to explain it. So decay itself is rotted tooth area. There are no nerves there. There's no feeling there. The mush, doesn't have any pain fibers. It can't feel anything. So what is the feeling that people have in a tooth? Well, if the tooth is already upset because the nerve is already inflamed, because the decay has gotten so close to the nerve, now anything you do that touches or bothers the tooth is going to potentially bother the tooth, like the cold water or the suction, which feels cold. Everything cold registers in the brain as pain for a tooth. That's the message it sends. It only knows 0 and 1, on or off, pain or no pain. And a little cold water, it doesn't say, oh, that's cold. It says pain, ouch, that hurts, don't do that. So a tooth that's in that stage, I think anesthetic is warranted. It's called for, getting the tooth numb so that you can work on it. But for a tooth that doesn't feel anything when you're blowing air on it, suctioning, water spray, if the tooth is okay and not having any symptoms when you do that, then what I generally will do is I'll offer the patient a choice. Would you rather be numb for this? And I'll let them know whether I think they're going to feel it or not after kind of checking the tooth. And some people do. They want to be numb. They don't want to feel anything, no vibrations, no water, no chance of any possible discomfort. Okay, fine. Other people are like, no, if it starts to bother me, I'll let you know. And, then we'll numb it if it starts to bother them. Okay. So if that's the case, then I'll go ahead and begin gently unroofing the area where the decay is. So the tooth structure over the decay that's hiding the decay underneath, that also has no feeling. There's nothing alive directly under it. It's just a shell. So that can just be removed. It doesn't hurt. So I remove that, unroof the decay, gently, slowly abrade out the decay, removing soft, mushy tooth structure with a little tiny spoon or a burr that's designed to just kind of gently remove and abrade. I'm not really drilling at this point. I'm just abrading away anything soft. I'm going so slowly that when I actually touch some tooth structure that's more solid, it actually stops the burr. That's how slow I'm going. So anything that's hard, I can tell the difference. I can feel it with how the burr moves. And I can also feel it when I use my little tiny spoon. And I will remove decay all the way down to where I'm at solid tooth structure. Now, that tooth structure may have staining because of the decay that was right next to it or food that had gotten in there. This is where there's a little difference of opinion. Is this decay or is it just stained dentin? Most dentists, and we're trained to do it, drill it away. Well, 1 minute later, you could be in the pulp. You could be in the nerve. The tooth could be bleeding from the inside because you removed the next layer because it was stained, which we're taught in school. If it's stained, it's decay, and that's not really the case because I studied karyology, and there's a layer of demineralized tooth structure that is not infected and does not need to be removed and can remineralize. And the nerve underneath will remineralize it from below. If you leave that and you allow the nerve to remineralize from below and you put a remineralizing base layer directly over that area, which will be under the new filling, you basically sandwich that demineralized layer between two things that will remineralize it from above and from below. Well, then you put the filling in and then you hope for the best and you hope that nerve remineralizes that area and heals. Now, this is in a tooth that hasn't had any symptoms yet, but has very, very, very deep decay. A lot of dentists will recommend a root canal instead of doing this kind of a procedure. Or they may do it and also send you to the endodontist or start a root canal. Or if they think they're real near the nerve, they will tell you, you know what, we're so close to the nerve, this tooth's going to need a root canal. Let's just go ahead and do a root canal right now. We'll just start that now, put a temporary, and you come back, we'll finish it and do a crown. That is how it usually goes. And you're lying there and you may or may, well, in most offices you're numb, so you don't know anything, and they tell you that they're at the nerve now, and this tooth is going to need, the decay was so deep it was into the nerve. And what are you going to say? You're lying there with a dam on, and you just say, oh, that's a bummer. Okay, well, go ahead. What else are you going to do? So that's the reason I call this show Give Teeth a Chance, because my goal is to do the decay removal in a way that I want to say to you, we got decay out. There was a demineralized layer. I put remineralizing medicine in there, and then the filling. This tooth could still abscess. The nerve could still die. The procedure, as atraumatic as I try to be, is still a procedure. The nerve may not like that. We were in there. We were drilling. We were removing decay. That could be enough to, kick it over the edge if it's real close. But let's give it a chance. Let's see if it remineralizes. Let me know if you have any symptoms. Then we'll move to the next more invasive thing that becomes necessary if that's the case. But let's give this tooth a chance. Let's give the pulp a chance to heal. Let's see if it remineralizes. Let me know if you have any symptoms. That's what I mean by give teeth a chance. That's how you, in my practice, how I treat decay in a way that, but I have a lot of experience with this. I know which teeth are likely to recover and which ones probably won't. But, we sit and we discuss what the chances are. So I wanted to talk about that because trauma to the teeth during a procedure, and by the way, when somebody is numb, it's a lot easier to go fast and cause more trauma just because the person can't feel it and you can get in there and do things real fast. I prefer when patients don't need to be numb or don't want to be numb so that I can be very, very light touch and not traumatize the tooth because it's just, I like the patient to be able to let me know if something's uncomfortable. You have been listening to another hour of Dental MD. I'm Dr. Jessica Sapoff, and this is a weekly show. There are archives. You can go to 1150kknw.com, Dental MD radio show archives, and check out topics that you may have missed or are interested in. And you can give the office call if you want to ask questions or get an appointment, 425-427-8899. And you can reach us by email, appointments@naturaldentist.com. Thanks for listening. I'll be back next week.
The views expressed on this program are those of the host, guests, and callers, and not necessarily those of KKNW, its management, or other advertisers. Contests are the responsibility of the host of this program and not KKNW. This is Alternative Talk 1150 AM, KKNW Seattle, and KNUC 98.9 HD3 Seattle.
And good day to you. Benny Mathers here for a look at your Alternative Talk AM 1150 traffic update for around the Sound. Well, if you're over on 520 westbound around the Microsoft campus, it's heavy around Northeast 51st Street all the way to the 520 and 405 interchange. It'll break free on the other side. Smooth sailing across Clyde Hill and into downtown Seattle. 405 northbound out of those S-curves is still heavy up through the Kennydale Hill. It'll break free at the top there around the I-90 and 133rd Avenue Southeast. Stay tuned. Coming up next after the news and weather, it's 2 hours of the Transformation Talk Radio Network. And in the first hour, an Embracing Divine Presence, Unity, and Love with Dr. Ibrahim Jaffe. Stay tuned.
Cohen sentencing. Russian charges. I'm Mike Moss. Michael Cohen's lawyer has told a New York judge that his client had the great misfortune